Shop Advisory Committee. I'd like to begin by announcing to the committee that Ellen Skillner, after years of service on the committee, has stepped down, and I'd like to express my thanks to her for all these years of help and advice. Going forward then, Martian, do you want to give an announcement about the recording?
Yes, Mr. Chair. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. And this meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. Thank you, Mr. Chair.
Okay, thank you. To begin, could we have a roll call vote of the attendance?
Sure. Grant Blader, Chair.
Yes, here.
Pamela Rasek.
Here.
Thank you. Paul Philpott. Shelley Sweet.
Here.
Thank you. Christopher McKinnon. Matthew Katz.
Here.
Thank you. And Paul Lombardo. Thank you. We don't have a quorum, Mr. Chair.
Good. Public comment. Is there any public comment?
We did not receive any public comments, Mr. Chair.
Okay. All right. Next, if I could have a motion to accept the minutes of the last meeting.
Motion to accept
the meeting from August 13th. That seems a while ago. Is that the last meeting?
Yes, this is Pam Russick. I make a motion to accept the minutes.
Okay.
This is Matthew Katz.
Second?
I second that motion.
Okay. Was there any comments, changes, edits to it? If not, could we have a vote to approve the minutes?
Grant Blader.
Yes.
Pamela Rasek.
Approved.
Paul Philpott. Shelley Sweet.
Approved.
Chris McKiernan. Ms. Sweet. Shelley Sweet.
Approved.
Thank you. And Matthew Katz.
Approved.
Thank you.
Okay, now I'll turn it over to John Carbone to discuss the individual coverage health reimbursement arrangements.
Thanks, Matt. Thank you, Grant. Good afternoon, everybody. Hope everybody's doing well. Yes, this is, it's been a while since we've had one of these meetings, but we have a good story for that. Over the past 8 to 10 months, we've been working on developing a platform from scratch for individual coverage health reimbursement arrangements, which we're calling it Business Plus. Our Business Plus platform will house our small group products and our ICHRA platforms, alongside which will allow employers to also shop for our standalone dental plan in there also. And the reason why we've developed this concept is over that past 8 to 10 months beforehand, we went out and evaluated the marketplace for this. And we felt that the products that were out there to introduce this to the Connecticut residents here and employers here wasn't up to par. It wasn't meeting the needs of the Connecticut residents and employers to be able to integrate with our current platform and deliver a seamless experience and allow employers to shop on the individual market, but still have that group feel to where it allows that employer to come in, be able to shop and look and see what meets their needs. Does the small group side meet their needs? Does the individual side meets their needs? Or does our ICHRA product meet their needs through our platform? Our platform will allow the broker community to be able to do this concept. They'll be able to allow to go through there and do these different types of quoting. What we did originally is we did go out to an RFP. There was a vendor chosen. That vendor then backed out of the contract, and we chose to go in a different direction, which was build this platform. So over the past 9 months, we've been building this platform with our vendor, Newfields Technology. Newfields Technology has been working with us night and day to make sure that we kind of start getting the structure, the foundation of this to meet all the IRS and CMS requirements. Today, we're going to walk you through a very high level look and feel and vision of the platform. We have been touching with stakeholders and making them aware. This is your time to kind of give us our input. We're going to also show share some marketing pieces with this. Our platform is to come into a full conclusion of and be rolled out to the marketplace on 7/1. Some of you may start hearing some marketing because we are going to roll this out for 7/1/2025. The marketing for this is going to be billboards. It's going to be grassroots, knocking on the brokers' doors and expressing the concept to them, going to employers, associations, NABIP, going to all, making sure that we hit all the different types of lanes and avenues, because we feel like this product is going to allow employers to save money in concept and save that, save money on the employer side and the employee side, and give those employees the choice they need versus that one plan option or two plan options in the small group. This is also going to work in groups over 50. If when that option does come, our main focus out the gate is going to be non-for-profits, because we feel like the non-for-profits are going to have a substantial amount of savings through this platform. The concept of this platform is to allow the employer to find the best use of their contribution dollar amounts. And I'll give you a quick example. One of our brochures shows an example of a group of 10, which it saves them almost 42 to 44% of the contribution amount. And that's because there are members on their teams that they were paying a contribution amount in a group of 50 and under, that they could have been going to the individual market and getting an advanced premium tax credit that was more substantial and was going to help them shop for a richer plan, while still allowing the other members to stay on a small group plan, or even eventually, or even if they consider purchasing an individual plan on the individual side, if it comes to where that plan is cheaper than the group side of it. So currently right now, there's not a platform that allows the brokers to do that, or allows the member to shop for in that type of format. This platform will allow them to do it. Under the ICHRA individual coverage health reimbursement arrangements, there are certain things that we must meet through CMS. It's called notifications. Right now, a lot of the vendors that were out there, this was all done manually. Our system is going to do this automated. We are trying to keep everything confined in the platform, not outside the platform. We're eliminating all the paperwork. And we built the platform to be extremely broker friendly, employer friendly, and then employee friendly, by making the shopping experience be as quick as possible and as easy as possible for that member, because some of the information is going to be automatically populated in the application if the employer chooses to go with the ICHRA concept, or an individual concept, or a small group concept. So we're going to have that. We're going to show a quick demo of the platform. And again, this is kind of in that hybrid stage of look and feel. We're in the beta phase. We're having our brokers kick it around a little bit right now, and going through that. We're getting some great suggestions. They're evaluating some of the marketing pieces. We're going to share some of the marketing pieces with this team, and we'd love to have some of your feedback. We understand this is an extremely complicated product. We know that. So the good part about this and the type of platform that we have built and we're building going forward as a unit is that we're going to be able to evolve. We're going to be able to make changes as quickly as we possibly do. We don't need to wait months and months to do releases. If we see that we need to kind of adjust something on the fly, we can make that adjustment to accommodate the broker community, the employer community, and the employee community. And what we're looking to do is keep everybody in this marketplace, in this Business Plus platform is the name we're calling it. And in there, they're going to be able to have their continuous journey. Give you one example, and I know NFT is going to do a quick demonstration for you, about 10 minutes, show you the look of the platform, the feel, and kind of just a little high level, 150,000 feet of how this is going to feel. And as we get all the Legos together, most likely towards the end of this month, beginning of April, we're going to come back to you guys and show you the full platforms from start to end on how it would work in many different scenarios. But let me give you one of the scenarios that we've kind of kicked around. We always have people in mixed households on how people have completely different journeys. If we have someone that is offered an ICHRA, they'll be able to, that family, and it's a family unit of 4, that family unit will be able to stay together in the same member portal, even though they may have separate products. So that entire family will be able to manage their different products. Example, the individual member, which is the employee, goes over to the individual side with the ICRA contribution, but the rest of the family may be under covered Connecticut, or may be eligible for an APTC, or may be eligible for a Husky. They'll be able to go to that side, and all that information will stay in that members portal. And the other thing throughout this whole thing is that the employer and the member will be able to use the platform to make payment directly to the carrier using the platform. So they don't have to leave. We're working with the carriers on lining that up and making sure we have both carriers and our other two standalone, our other dental vendors all in place to make sure they can accept the payment direction we're going. And we're happy to know that we're on the same page with everybody. So with that, before I jump into NFT, I'd like to see if I have any feedback or any questions regarding this. Yes, Matt.
Yeah, and I'm sorry, I was struggling with trying to raise my hand. So I have two quick questions. One is, if this is launching, is the marketing launching on this in July, or is the plan itself launching in July?
7/1 is actually when we can have our first enrollment in the system and have an effective date. The marketing is actually launched this week.
Okay, I'm sorry. I just wanted to be clear. So stuff's going out this week, and it officially goes live from a perspective of people being able to be on the in the system July 1st.
Yeah, we'll start quoting. We'll start quoting probably right around the end of April, beginning of May, or in that time frame with our brokers. It's going to be a heavily broker-driven product. Especially with groups over 50. It's going to be a heavily broker-driven product. But we understand that the groups under 50 are going to sometimes. Right now, our participation is 88% brokers. So we'll have that 12% of employers that our team will have to walk them through the platform, which we will do. We will have a supporting team on both sides of the fence.
I think that's great. And you had mentioned, John, that you guys are focusing on those smaller not-for-profits.
Correct. Yeah. Sorry, Matt. Go ahead.
That's good. Many of them are tied to, in the state of Connecticut, associations. Have you gone to those associations to identify that this is going to be available? Maybe they're part of SAE, some other local groups where their executives all participate. That may be a good way to market this, because they are that could specifically benefit, do tend to come together through those associations a few times a year.
Yeah, we have 9 meetings scheduled with all our chambers and associations regarding this. Connecticut Alliance is one already, and we have met with several groups already that have kind of came through from the Connecticut Alliance to basically say, hey, this is a group that may be interested in this, and we've started giving them some concepts, and we're using them as part of our beta to kind of make sure we kind of capture all the information we need, and they're getting the information back as simple as they possibly can to make that decision. So the answer to your question is yes, we are working with all the associations and chambers.
And I just want to highlight that the chambers are great for small business, but they're not so great for small not-for-profit associations. Many of them
Correct.
Can't afford to join the chamber, so they don't. They join the not-for-profit groups instead. And so, like, the Alliance is a good example. So I just think you have to think outside of the chambers or Better Business Bureau to really look at where these folks.
So I think we have a meeting with the Alliance in the 3rd week or 4th week of March. So yes, they are part of the equation.
Okay, thank you, John. Appreciate it.
You're welcome, sir. No problem. Any other questions before we move on to Kunal and his team? Kunal is Newfields Technology. They're a vendor that we've been spending a lot of time with to go through this. As you'll probably see, you're going to see a like and feel of the platform and the vision we have for this. We will be evolving it, and like I said, putting this together, and I do use the terminologies of like Legos, because that's how we're building this, because we want to make sure that we can move as the market moves, and as our things come in, we can adjust what we need to adjust to the platform, so we can evolve and continue to bring a seamless experience, because that was extremely important to us, to make sure that we created that easy experience and easy enrollment through the process, and from the brokers to employers to employees. So at this time, I'm going to turn it over to Kunal and his team, and he'll kind of walk you through the demo. At the end, in the meantime, I'm going to drop a few of our PDFs and some of our frequently asked questions in the chat that you guys can have. These are documents that we'd love some feedback from you, and go from there. Thank you, Kunal.
Yeah. Hi everyone. So this is the test environment of the Business Plus portal. And as the website indicates, the targeted audience is primarily brokers, employer, and the relevant employees. So there is some information which is available if, as a broker, I want to see what this is all about, what features are available. There are going to be talking points, like you can view financial models if you're moving a business from their current plans towards an ICRA program. Similarly, you can see information as an employer, what all you need to do to get onboarded with ICRA. And so just to give you a bit of an overview and look and feel, I'll log in as a broker.
Hey, Kunal, can
Yes.
you go back to the main page
Sure.
and kind of go a little bit slower and just allow
Yeah.
people to kind of see the different functions, go from north to south, and
Yeah.
just allow the people to see the different type of vision we have, and what we're doing and how we're, giving brokers some options. Some of the language in here is going to be tweaked a little bit, and it's going to be more for each individual. We're trying to put a minimum amount of information, not to cause any clutter, but the information they need to be able to complete the task or gather some stuff. So some of the marketing materials that we're going to share with you potentially may be in the broker section and the employer section. And then some of the frequently asked questions also may be in the employee section to help them potentially shop for a plan, or how ICRA can be beneficial. But as you kind of go through this, all this stuff is going to be interactive. They'll be able to click on any object to be able to get them some of the basic information they need and where it's going to go. So as you can see, we just tried to keep it clean, simple, kind of, blend the two relationships of the individual side, the small group together to bring out the Business Plus concept.
Right. So the broker can onboard an employer. They can create quotes, do a comparison between how much they're spending currently with whatever program they are on, versus if they get onboarded with ICRA and see the savings. They can work with the employees to get them enrolled onto the Access Health platform. Similarly, if this is an employer, they can define their contribution levels. If they're an ALE, then ensuring they're giving an ICRA which is affordable for their employees. They can monitor the plan enrollments, the census of different employees, the overall reimbursements. The employees can come into the portal and do the enrollment, do their change request management. They can update their personal information, check their reimbursement status and payments as well.
So as you heard, Kunal mention the word ALE. That is basically a large group over 50. As you guys may know, that groups over 50 have to provide affordable healthcare coverage. So we have the platform to be able to figure out that contribution for that employer, for the broker, based off of the lowest cost plan. And then the platform will allow them to manipulate the numbers, how they need to best fit their needs and their cert price points. Matt, do you have a question, or is this still from the last time? Thank you, sir.
Sorry about that.
That's okay. Just wanted to double check. Thank you.
Yeah. Now I'll log in as a broker. So this is going to be by opening dashboard as a broker, where I can see who are my current employers whom I'm working with. If I need to onboard a new employer, I can do that. There's going to be group ID, their name, what date they got onboarded on ICRA, how many employees are there within that particular employer, what state they're based out of, the date they were added, if any information needs to be edited. So I set up a new company, Tariffs Monitor, just to stay with the current times. and I onboarded them. If I need to edit any information, I can do that as well. And so one of the essential features of ICRA is, of course, the class management. So you can set up different set of classes for the different employees that you have. You can have full-time employees, hourly employees, salaried, and you can do even more combination of classes as well, where certain employees may be in a separate geographic location. You may have seasonal workers. So you can set up that class and define that contribution amount as well.
So-
And with it, yeah.
Now, I just want to jump in here. If
Mhm.
many of you are aware, once you get the frequently asked questions from us, it'll be shared over by March, and I can't drop it in the chat for some reason. You'll see that the IRS allows employers to create what they call classes, and each one of those classes, they're allowed to create different types of contribution strategies, and that allows the broker and employer to find the best way to have that savings for that employer or that employee versus putting all the executives in one plan, knowing that they're either going to stay in a group plan or potentially just go to a straight individual plan and potentially have a group of individuals who are all floor people on a certain dollar amount that they get paid. They all may be eligible to go get an advanced premium tax credit, and they'll be able to stay in that other class and be able to go get those tax credits, and which could be substantially more than what they may be getting on the contribution side from the employer, and be able to shop at all 22 plans. So you'll see that those concepts in that question. So I just wanted to clarify that for you.
Yeah. And even within these classes, you can set up if this class is relevant for contribution only towards the employee, or you want to add a separate contribution for each dependent on a per month basis. And then if you within a class, you want to customize the contribution based on different age bands, where say for someone who is less than 30, you want to give a certain contribution amount, and over 30, you want to add an additional dollar amount. So you can do all those configurations. The next step is going to be the census management. So for this particular employer, I have the employees who are preloaded, and I can always add additional employees towards a company. There are two methods. I can just add it via this web interface, where I can click on this and fill out this information and add the employee, or I have the option to import through an Excel format. And that Excel format usually looks like this, where you have information pre-filled. This is all test information, social, date of birth, address, etc. And you can edit these employees as well. So after all the employees have been set up, the next step is usually the creation of the quote. So all the plans which are available on the exchange, they are available for selection to create the code. So say I want to select the gold plan, I can select a bronze plan, and then I want to pick up a silver plan. So I can do that, and I can define the contributions based on the class. So the system is going to prepare the quote on the basis of this. And I can give a quick rundown of the quote. And we are in the process of revamping the code to make it even more cleaner. So it's more visually appealing. As John mentioned, we are working on this actively based on feedback from different stakeholders. So this quote is going to talk about different employees, how much their contribution is, how much ICRA contribution is going to be. So all that information which usually a broker needs to onboard an employer or show them how much they're going to be saving, that entire information is going to be available in this particular quote.
So as
Yes.
Kunal, Pam, I'll grab you right after the statement. As you guys see, we've revamped this whole entire spreadsheet. There will be what we're calling an executive page for the employer, which just kind of states where they currently are, how ICRA is going to help them, and then show them the side-by-side comparison of this is where you are. This is where ICRA is. This is what it's going to save you on a monthly basis. This is what it's going to save you on an annual basis. And then there is going to be additional information that is going to basically support all of the facts and numbers that we've given on the executive page. Pam?
My question has to do with, I know this is set up, so it's right now anyway, demonstrating if it's all Connecticut, but I assume that for each state, you would see a comparable summary, or is it, how would like multi-state examples present?
So currently right now, what we're going to do is for kind of this first version out the gate, any employer that has an employee that is out of state, we're going to handle that manually off to the side. So that employee is going to go shopping for their plan in their state, and
Right.
then they're going to purchase their plan and bring back the receipts, and that'll allow the employer, if they're eligible for an ICRA, to provide that contribution. We are going to start working on phase 2 on enrolling all the healthcare.gov platforms, which will hopefully be able to integrate everything. So we'll be able to at least have those 21 states that will be involved, and then start talking to all the SBMs one at a time to figure out how we can create that that integration. But as you can see, it's a big task. So we're going to kind of focus in on getting this tight and then start bringing in, because we know there's probably going to be that 10 to 15% that we may need to in the beginning kind of manually hit. And then as the technology platform evolves, integrate it right into everything.
Okay, that's great. Is there any way after this you could, for those of us that are part of the committee, just sort of like indicate the timeline like that? Phase 1 is this, and and again, not necessarily hard deadlines, but like roughly what comes next and next till you get to what you think is the end? Could you chunk that a little bit just to give us a sense for how it's unfolding?
Absolutely. We can definitely do that. We have a Gantt chart that we can share with you guys that'll kind of give you a roundabouts up to the first phase, and we're working on the Gantt chart for the second phase. So we'll share phase 1 with you guys, and then phase 2 of the Gantt chart will be completed after the fiscal year. So we'll be able to share that with you also, maybe at one of the other committee meetings that we're going to have coming up, but we'd be more than happy to share that with you.
Great. Thanks. That'd be super.
You're welcome, Pam. Thank you. Kunal?
Yeah. So the broker can view their quotes that were generated in the past in the system itself. If a certain quote gets sold out, they can mark it as sold over here for tracking. And I can view all the clients who are connected with me, different employees across different employers for managing their enrollment or supporting them. Then so as a broker, I can work with different employees. So all that set of toolkits and features is going to be available right over here. Next, I'll go in. So after broker has set up an employer, the next step is usually for an employee to come into this platform and start doing the enrollment process.
So as Kunal kind of plays with that, I kind of want to give you guys a little bit of a vision. I know, Shelley, you have a question. Why don't you ask your question first, please? And then I'll kind of go through the other points.
Are you sure I can totally wait? I'm not in any hurry.
No,
It's up to you, whichever you think
no.
the flow is.
No,
Okay, my question is pretty straightforward. In terms of broker and appointments, are brokers going to have to be appointed both on the individual side and on the group side? Well, I guess on the group side, they're appointed through the carrier. I'm curious about what the, I guess, appointment/education process will be for brokers.
So you are going to have to be, as long as you're certified on the individual side, you're eligible to do anything on the Business Plus platform. If you're certified to do individual plans, and you're certified for the individual and small group, you're able to do everything you need to do on the ICRA platform, on the Business Plus platform with ICRA.
Okay, so that just leads me to one question. Is it still the case that you can only do that once a year? So in other words, will this roll out in July, but brokers that aren't currently appointed couldn't get appointed?
Yeah, so last year, a couple of years ago, actually, we kind of changed that policy a little bit. So as a broker is able to enroll and go through the certification process any time of the year.
Beautiful. Thank you.
You're welcome. So with that
And-
being said, another kind of little thing for the brokers. I know he's kind of Kunal has showed you the journey. The thing that we're looking to do is as all that information from the original quote is provided by the broker or the employer, dates of birth, city, addresses, dependents, and all that stuff, all that information is going to get uploaded into the system. So as the member starts creating an account, all that information flows into their application. All the broker information flows into the member's application too. So they will not have to punch in the information, go through it. All that stuff is going to be pre-populated. They're going to be accountable for validating all the information and kind of just going through it and making sure the information is correct. And if they choose to add any other dependents or delete dependents, that can change the scenarios. If that does change the scenarios, they'll be indicated. But what we wanted to do is create the least amount of typing and the least amount of clicking.
I know
No?
my hand's not raised anymore, but I just want to say it looks awesome, John. I really like the system. It's amazing. And I don't know anything like it in the marketplace. I agree.
Thank you. We appreciate that.
So as an employee, when they come to sign in, they will be putting in the information. So we have established the same security protocols, and the system talks to the existing exchange. If on the basis of email or date of birth or social, we determine this person already exists in the Access Health ecosystem, we prompt them here itself like, hey, you already have an account with us. Just use an existing account and then you go ahead with that. So I'll just use an account which I had created for an employee. So this is going to be the interface, and we are constantly improving upon this design as well. So as John was mentioning, when the user is going to log in, most of their information is going to be pre-filled over here, what broker had set up. So the amount of work which an employee has to do to complete the enrollment, that is going to reduce drastically. So the broker on record is going to be present over here. The address information will be pre-filled. They can, of course, come in if they need to edit something, they can edit this information out and then approve that. They can see their household information. All the security stuff is usually masked, but if they hover, the complete information will be visible. They can again edit whatever is required. Uh, and on the dashboard itself, they can see their status, if ICRA is going to be affordable for them or if it's not affordable. So they can make a choice over here. If they want to go ahead with ICRA or they want to reject ICRA and want to go with the regular QHP route. If someone wants to look into the how ICRA was calculated, the entire detail is present and being made available to them right over here itself. So they can see the numbers that the household income was this, on the basis of the regulation, the affordability limit is this, and the employer is contributing $400 and their monthly contribution is 408.25. So all the numbers are going to be present right over here itself before they even start doing anything else. So if the employee makes the decision to opt out of ICRA, from here itself, they will have an option to continue their application on the individual marketplace or the existing consumer portal, and their entire information which has been captured on the Business Plus platform, that will flow in right over there. So they don't have to enter all of this information again. They can just continue their journey right from the step itself. And on the other hand, if they opt to continue with ICRA enrollment, then they can continue their application here itself and complete the enrollment. So the enrollment process is fairly simple, and it's similar to what we currently have, but we are in the process of revamping the screen. So the number of clicks that the user has to go through in order to do the application, that comes down drastically, and we are capturing only the relevant information for what is required for an ICRA program-based QHP enrollment. Uh, John, I believe that's all from my side, unless you want me to show the enrollment.
No, we're perfectly fine with that. So I just want to
Okay.
make you aware, even over the past couple of weeks with some of the feedback we've gotten and some of the teams, we've updated about 30% of these kind of screens, look and feel, some wording, some additional buttons, some additional call to actions, and we've streamlined this stuff. So over probably in the next 2 to 4 weeks. Here's a quick Figma mock-up of a version of what we're going to be doing and some of the information on how we're streamlining the look and creating more of a bucket button feel so people can find the information they need. At first, I got a little nervous. I thought this was going to be this small, and I'm like, I'm losing my vision a little bit. I need reading glasses. But when you see it more in a technology platform, it is clear, it is bright, it is big. The shading brings out the information so you can read through it and go through that environment. So we're looking forward to showing you the next evolving stage to it, but we also too, over the next week, as you guys absorb this information and look at some of the stuff, we would love some of your feedback so we can see if we can make this easier. We tend to kind of work and make sure we introduce all the stakeholders to this. But sometimes as we continue to work as technology people and the salespeople and the legal people all come together, we do need some outside feedback to make sure that we are on track. So we look forward to that. So from there, I'm going to kind of turn it over to you guys, see if you have any additional questions, and we'll go from there. Pam?
Yeah, I want to go back to the beginning when you mentioned about broker support versus exchange support for a business. Can you kind of review who gets supported by whom again for me, just to make sure I've got it clearly in my head?
So what we mean by broker support is us as an exchange will support our brokers when they're going through this process, which means that we'll help and support the employers and we'll help and support the employees through this process. And our team here at the exchange will help every version of that. We will help the broker with the concept of ICRA and Business Plus and the concept. We will help the employer understand what their requirements are going to be to CMS, IRS, and to their employees. And then we're also going to help the broker with the kind of education of having the employee go through the portal. So the exchange is going to have their hands in all three of those lanes to make sure that everybody has the experience that we want them to have. And that is a seamless experience from start to end, and to make sure that we maximize their time to get enrolled and get coverage as fast as they possibly can. The one thing we did leave out on this that I did mention before, I just want to make sure we talk about it. We are going to build in a payment system in here that allows the employer, when they have ICRA, to be able to make a contribution payment and the member to also be able to contribute when they are not. Remember, you can't get a ICRA contribution and get an employer contribution. It's one or the other. They can't get an ICRA contribution and get advanced premium tax credits. It's one or the other. But if someone is getting a ICRA contribution from their employee. Give an example. They have a $400 premium. The employer is paying $300 of that, and the employee has a remaining amount of $100. They can each make a payment into an account, which that account then gets shipped to those funds get shipped to the assigned carrier, which are posted against that member's account. So we're also going to help the carriers make sure that we have individuals that stay on top of their payments and stay covered because of that. So we felt like it was very important. I hope I answered your question in the beginning, Pam.
I think you did. And one follow-up would be, so if I run into small businesses who ask me about brokers that can help them with ICRA, where do they look to find one? How do they find one?
We're going to start our broker training in the next 2 weeks. And
Okay.
from there, we haven't identified how there's going to, so ICRA is not new to the marketplace. There are brokers that are currently doing it right now. So everybody's familiar, but we're going to start training people within the next month and a half when we have finalized portal view, look and feel, and everything is done and approved by all the stakeholders. We're going to start our broker training first. We're going to start our internal training, our broker training, and then we're going to go out and make sure. So we're going to figure out how to identify that. But see, this is why we talked to you, because we didn't have any special identifier. So that was a great point and takeaway from you, Pam. Thank you.
You're welcome, and thank you for the answer.
So with that being said too, I forgot. Wow, that was quick.
Hey, John, very quickly. This is James Michelle. I just want to comment and thank John and his team and also our consultants, because this has been a project we started last year, and we are almost ready to launch this. You know, this is anticipated from across the state of Connecticut, especially as a solution for small businesses who are struggling. We provide health insurance to the employees. We think this is an opportunity to really make health insurance more affordable for the small nonprofits in particular, where they have low income earners, but however, they need health insurance and they do not qualify for some of the benefits that the state offers because they are working. We think this is a great opportunity to really expand the individual marketplace by providing health insurance, make the individual market more accessible to small groups. We look forward to it. This is not going to be easy, because the brokers, we have to spend a lot of time and energy educating the brokers, convincing them how this is going to benefit their clients, the small businesses that they represent. There's still a lot more work to do, but we're very proud and happy where we are with respect to having a platform that's going to make it easier and make the individual market more accessible, and also make the advanced premium tax credit accessible to more individuals in Connecticut that currently work for small business.
So thank you, James, appreciate that. Before we jump into Matt and Shelley's question, I want to mention one other thing that I think we left out extremely important. The great part about this portal too is, unfortunately, if someone does leave an employer and they are in an ICHRA contribution plan or an individual plan in some shape, the plan is portable. They do not lose coverage. The plan follows the member, does not follow the group. So if the member loses employment or chooses to go elsewhere and has to wait before a waiting period, the member can take that individual plan with them. So they don't need to terminate that plan and come back on and start another plan. The plan is portable to the member, and they can continue to make payment directly to the carrier. So it kind of alleviates that little bit of stress on the COBRA. So I don't know who was first, if it was Shelley or Matt. I'll let you two fight it out.
I'm second. Matt first.
Okay, so I'll go first then. So thank you, and thank you guys for sending the marketing material. I think it's great. I had one suggestion, one addition. What we didn't see, but I saw that you had, was that you had a formula. You had a modeling for employers and for brokers that they can model their costs and their savings. It would be nice if you had a part of the flyer that walked through 10 employees, 5 employees, just did some fictional amount and number to show what that savings could be or what that opportunity is. I find, at least today, post-COVID, if you give people kind of a scenario and you visually walk them through it, that you don't need all the language, you don't need all the text around it. They just see where the savings and benefit is, and that seems to make a lot of sense. And you don't have to be so text heavy. So I'm just talking about like one schematic, one diagram that shows the number of people for a small employer, how much they're paying now, how much they're going to pay, and how this program would work, just on one not so messy, not so busy page.
No
That's
problem. No, we appreciate that feedback. So take a look at the brochure that has the City of Hartford on it in the middle section. We do show that. If you feel that that's too much, we'd love your feedback on that, how to streamline it and clean it up. See if that one scenario on that middle page works for you, Matt. Shelley?
I'm sorry, John, I saw that. I was thinking that being a full page.
Okay, so
just
you're
by itself, without adding any text, maybe even taking some away, that being a separate page, because it gets lost because there's so much on that page with the two sides.
Okay.
That's all.
Oh, appreciate that. Thank you. Great suggestion. Shelley?
I was curious how the system accounts for employees that are, this is an and/or or either Medicare eligible and or Husky eligible.
So we are going to be integrating the platforms together, and our quoting tool is going to have some of that logic built into it based on some of the numbers that we know already. But on certain situations, we are going to have those conversations with the broker, especially out the gate. Once we get to the 10 clicks project, which is on the individual side, and we can integrate all this stuff together, it's going to be a little more technology heavy versus right now. It's probably in the beginning going to be a little more manual, a little more kind of executive help to the broker with those two concepts.
Okay, so is it correct to, in the individual market, that if I go in, no wrong door, so I go in and enter and I put in I'm Medicare eligible, it boots me out, right? And says you need to go here to get your coverage. And then same scenario, but now I come in and I'm Husky eligible, it says this is what you're eligible for, right?
Yep. Same concept. That's what we're leaning toward.
Okay, cool.
Yeah, just to add to what John mentioned, we are running against the same rules engine. So the guardrails of eligibility which exist in the current system, they apply to the Business Plus platform as well. So you can't game the system outside of what exists currently with the rules engine.
That makes sense to me. Okay, so the system rules would be the same. So then that's where the manual part would come in, right, John? Now we've got these people that look like they can't be covered, but they need to. Okay, got it. I think I got it.
Cool. 2 questions, 1 question, Shelley?
No more questions. Need to put my hand down. Sorry.
That's okay. Does anybody else have any additional questions? Okay, with that being said, Grant, I'm going to turn it over back to you.
Well, thank you very much. This looks great. Amazing progress in a short period of time, and you seem to have a path forward that's going to get this out by July 1st. So with no further ado, could I have a motion to adjourn?
Grant, can I interrupt for 1 second? I don't know where you had made a note about Ellen, and I'd like to. There wasn't time before. Can I respond to that or ask a question on that?
Yeah, sure.
Sure. I've been part of a lot of other state entities, quasi-governmental, governmental. They usually send a little letter or certificate. Are you guys planning on doing that for? She has been there since the beginning, and I know she's leaving. Maybe a nice.
Yes, we do. Yeah, and Matthew, we do have a certificate and a nice plaque we send to board members, and as well as volunteers who have been with us for at least 5 years. We do send a nice letter from myself and from the chair, along with a nice plaque. The plaque is designed in the shape of Connecticut, expressing our thanks and appreciation for their time the time and knowledge that they've shared with us to make us basically we are the #1 exchange in the country because of people like Ellen and you guys and our board members. So we certainly appreciate that, and we'll recognize that and hope your time.
Thank you. That I appreciate that. That's really all I wanted to make sure was that she got some sort of formal recognition. And thank you, Grant, for recognizing her. She'll be missed. And I just wanted to say that, having spent this time with her on the committee, she'll be missed. And then the last question I guess I have, I don't know who it's for, if it's for Grant or for who, but how do we replace people on the advisory council? How do we, the Small Business Advisory Committee, because I'm assuming now we need a replacement.
We do we work with the chair of the committee. We recruit. We ask for John, myself, the chair, and also we ask other committee members if they have any recommendations. We get the names. We look at their qualifications, and we vet them out. And if we have somebody that's interested in that meets the criteria as spelled out by the legislation, then we discuss it with the chair of the committee. Then we forward it to the board for approval. Once the board approves approves them, then they join the committee. So that's the process, and we are in the process of recruiting
that-
somebody to
That
replace
said,
Ellen.
now, Matthew, if you know of anybody, you could sort of ask them to, move forward.
Well, that's what I
on.
was thinking is have someone forward information
Yeah, just
in.
contact me or James,
Okay.
have them contact me or James.
Yep.
We
Perfect.
do sort of check it out to see if they're appropriate or
Oh,
not.
absolutely. I just
Yeah.
wasn't sure how we were doing that, but I'll have them, I'll reach out to the two people I was thinking and
Great.
see if they can reach out to you guys if they're interested. Thank you.
Okay, sure. Thank you. All right, then. Could I
This is-
have a
Yeah,
motion to
this is
adjourn?
Pam. I'll
Yep.
motion to adjourn.
Okay, seconded?
This is Matt, second.
Okay. Is there any comments before we have a vote? If not, let's have a vote to adjourn. Roll
Brian
call.
Ritter,
Yes.
Tom Brasek,
Yes.
Paul Philpott, Shelley Sweet, Chris McKiernan, and Matthew Katz.
Sorry, Shelley. Yes.
Shell. Okay, thank you.
Matt,
Thanks,
yes.
Shelley.
Thank you.
Okay, we are adjourned. Thanks, everybody. And
Thank you.
John, I suppose we'll be hearing more very soon.
Yes, absolutely. I'll get some more dates on the calendar very soon.
All right, then.
Thanks,
Thank you,
John.
Looks
everybody.
great.
Thank
Thank
you.
you.
Thank you.
Bye-bye, everybody.
Bye
Thank
now.
you. Looks great.